The coronavirus is tightening its grip on our state. New tonight, a second person has died of the virus in King County. Thanks for joining us. I'm David Rose.
And I'm Jamie Tompkins. This death is part of 4 new cases announced by Public Health Seattle and King County. And according to a news release, the person who died was a man in his 70s, hospitalized at Evergreen Health. He had underlying health conditions and died yesterday. There are now 13 confirmed cases of COVID-19 in Washington state. So here's a breakdown from the State Department of Health's website. 10 cases are in King County, including 2 deaths, and 3 cases are in Snohomish County. There are 231 people under supervision, and that number includes people at risk of having been exposed to novel coronavirus.
Health officials say all 4 of the new cases announced today stem from the potential outbreak at Life Care Nursing Facility in Kirkland. Q13's Hannah Kim live there at that facility tonight with the very latest. Hannah?
Yeah, David, you are right. All of the 4 new cases announced late today are linked to Life Care Center here in the Kirkland area. Sadly, as you guys mentioned, a man died yesterday. He was a resident at. There are also currently 3 more confirmed COVID-19 cases. There are a woman in her 90s, a woman in her 80s, a man in his 70s. They all have underlying health conditions and they are in critical condition right now. The epicenter of the coronavirus outbreak is now this nursing facility in Kirkland. Life Care Center on the national radar as confirmed COVID-19 cases continue to climb.
The biggest thing is just the concern about how many people will be affected.
Kim Fry from Eastern Washington knows visitors are not allowed with residents under quarantine.
We love you, we can't come in.
So she brought a sign, hoping to hold it up to the window outside so her 89-year-old mother can see it.
I'm concerned that she's going to feel alone, and that's going to contribute to her downfall, really.
Despite the outbreak, this daughter desperately needed her mom to see her.
They told me I wasn't going to get in.
But she eventually did get in with protective gear.
My mom was good. I didn't hear any coughing. It's kind of quiet in there.
Kim's mom may not be showing any signs of respiratory issues related to coronavirus, but health officials announced today 4 new confirmed cases of COVID-19, all linked to Life Care. One of those 4 cases, a man in his 70s, died yesterday, bringing the total death in Washington state to 2.
Yeah, that's concerning. I'm so sorry.
The uncertainty of the coronavirus has Anissa Walsh self-quarantining herself along with other family members who visited the Kirkland facility.
Little panicked, but I'm a nurse myself.
Walsh says she visited her mother-in-law at the facility a day before news broke of the coronavirus cases.
My sister-in-law did get a call yesterday saying that her mom didn't, have the fever and that she was doing okay.
That's the best case scenario on a day we saw staff workers wheeling out a patient with the help of first responders. It's unclear if this emergency is linked to COVID-19, but first responders said this before they left the scene.
It seems to be respiratory.
Well, yesterday, King County Public Health said that they had more than 50 people at Life Care showing some type of respiratory illness, but that number was compiled since mid-February. Today, the center, Life Care, saying that they're only seeing 7 residents with any type of respiratory issue. All of those people will be tested for COVID-19, and experts are expecting the number of confirmed cases to climb. We do know that CDC officials, a team of them, arrived here in Washington state, and they are currently helping King County public health experts on how to best contain this outbreak. Guys, back to you.
All right, and there are also a lot of moving parts at Lake Washington Institute of Technology because 16 nursing students were at Life Care. The college says they're waiting for guidance from King County Public Health on how faculty and students affected can self-monitor. Also, the school says they're closing the college tomorrow and Tuesday to clean the facility. They do say that there is a low risk to the greater college community, even if students have come in contact with faculty and students who were at Life Care.
Well, 25 Kirkland firefighters and 2 police officers are under quarantine because of the outbreak at Life Care. The city of Kirkland says this is just a precaution. They responded to calls for various medical complaints at Life Care Center for the past few weeks now. Some are under home quarantine. Others are utilizing a Kirkland fire station for quarantine. The city says the Kirkland Fire Department is still fully staffed.
Governor Jay Inslee issued a state of emergency yesterday, directing agencies to spend resources to prevent further outbreak. The King County Emergency Operations Center is activated, and a state lab based in Shoreline is testing 200 specimens per day for coronavirus. Dr. Jeff Dushin with King County Public Health believes we will see more cases soon, but to keep this in mind.
Novel coronavirus infection, as has been recognized, is spreading globally. And we are having increasing cases in the United States, and we expect to see increasing cases locally. It's very important for everyone to remember that 80% of the cases are mild. Patients frequently don't even need to seek health care. You can think of it as a bad influenza-like infection. However, as these recent cases demonstrate, it can be severe.
Governor Inslee will hold a news conference tomorrow afternoon to give an update on the virus in the state. He'll be joined by other state health officials, and we'll carry that here and on our Facebook page.
Now, we know you have a lot of questions about this. We want to get you answers. So we invited a medical expert to our studio this morning. Dr. Drew Oliveira, the Senior Executive Medical Director with Regents Blue Shield. For starters, we asked if we should avoid visiting certain locations where lots of people gather, like a sporting event.
We do want to limit our travel if possible, just in general, and being around large numbers of people in general. So there's recommendations from the workplace to if you can work at home, that's great. That will limit your exposure to other people. We follow the lead of our health departments, and they will monitor the situation in terms of, what's the potential risk. Right now, the potential risk is still low, but each health department has the jurisdiction to limit attendance at events like that or schools and otherwise.
Another question from our viewers: what is the best way to avoid getting sick?
The most important things are personal hygiene. So wash your hands, soap and water, 20 seconds at a minimum. Wipe down areas where that may be contaminated. If you have to work with the public, try to be at least 6 feet away from the other person to prevent any of that transmission of aerosolized droplets. There's no known treatment right now. It's supportive treatment.
Now, according to the CDC, symptoms include fever, cough, and shortness of breath. Dr. Oliveira says if you feel like you're getting the symptoms or have been exposed, talk to your doctor. Don't go right into the office. Call them first, let them do a review, make sure that you're safe, and then they can monitor you if necessary. Now, the State Department of Health also has a hotline to answer questions about coronavirus. It's 1-800-525-0127. DOH says it doesn't have any directive regarding self-quarantine if you don't have symptoms. And as we mentioned, if you do have those symptoms, call your doctor before you show up at a clinic.
3 schools will be closed tomorrow over coronavirus concerns. A Hazen High School student and one of their parents are experiencing a flu-like symptom and were tested yesterday for COVID-19. School officials decided to close tomorrow out of an abundance of caution. Superintendent says the student and parents are in self-quarantine at home while waiting for test results. Custodial staff is cleaning and disinfecting the school. The other school that will be closed tomorrow is in Snohomish County after a student tested positive for coronavirus.
Yeah, the teenager who goes to Jackson High School in Mill Creek didn't travel anywhere, and health officials don't know how he got this virus. Now, health officials say he showed up to school on Friday because he was feeling better, but then the test results came back positive for COVID-19. So he was sent home before he even went into a classroom. Any students that were in close contact with him are now on a 14-day quarantine. The school is also sanitizing the building for 3 days. That started on Friday night. Now, we've also learned Frank Love Elementary School in Bothell will be closed tomorrow. In a letter to families, the superintendent says a staff member with flu-like symptoms is being tested for COVID-19 and has been told to self-quarantine. Now, the closure is out of an abundance of caution and allows time to disinfect the entire school.
There are more than 70 confirmed cases of the virus in the U.S. Vice President Mike Pence is leading a federal task force to combat the spread of coronavirus in the United States.
Congress is also working to get the funding for more resources.
I asked for $8.5 billion, $1.5 billion to the CDC to continue rapid response, $3 billion to public health, $2 billion to reimburse state and localities, and finally $1 billion to get this vaccine over the line.
Well, vaccine is in development, but is still at least a year away. Lawmakers want to make the vaccine free for one of the most at-risk populations, senior citizens. President Trump will meet with drug makers at the White House tomorrow, and he's expected to visit the National Institute of Health and the CDC headquarters later on this week.
You're watching King 5 News. Well, a second person has now died from the coronavirus in this state, and authorities say there are now a total of 13 cases here. 3 of those cases are in Snohomish County. The other 10 are in King County, and the 2 now confirmed deaths are among those cases in King County. We have team coverage for you tonight. We're going to begin with Kristen Ayers in Kirkland, where the most cases are centered, including the latest death. Kristen.
Yeah, the man who died of coronavirus, the second man to die actually in Washington and in the country, lived here at Life Care Center facility. Some family members we spoke to whose family members actually are living here as well said this most recent death is hitting far too close to home.
A second death? Here?
A woman stunned to hear of a coronavirus death at the nursing home where her 89-year-old mother has been living for 3 weeks.
Yeah, that's concerning. Too close to home.
Kim Fry traveled from Twisk, Washington to see her mother at Care Life Center of Kirkland tonight, the nursing facility now at the center of an investigation into a possible coronavirus outbreak. More than 50 people who lived or worked here are hospitalized and undergoing testing for coronavirus. Ambulances were coming and going last night and into this evening. The 4 new cases announced tonight, the man in his 70s who died, and 3 other patients in their 70s, 80s, and 90s, all in critical condition. Initially, the facility banned any visitors, but Fry says she was given a mask and allowed to go inside.
I didn't hear any coughing. It's kind of quiet in there.
Inside, some patients who may have been exposed were being quarantined, but there are already concerns that the disease has spread beyond this building. 25 Kirkland firefighters and paramedics who may have had contact with coronavirus patients are currently quarantined. The Lake Washington Institute of Technology campus will be closed Monday and Tuesday, while crews disinfect it after 17 nursing students and 4 faculty members spent time at the nursing home last week. Back at Life Care, Fry says her mother is one of the lucky ones who is symptom-free.
Anyway, she looks really good tonight, so I'm very encouraged.
Now, the first coronavirus death in the state and the nation was, of course, the man we told you about all yesterday. He was in his 50s and was medically high risk. He died yesterday at Evergreen Health. Live in Kirkland, Kristen Ayers, King 5 News.
Kristen, thank you. Updating you on some other coronavirus cases we learned about earlier today. A man in his 60s is hospitalized in critical condition at Valley Medical Center in Renton. The hospital says he's in an airborne infection isolation room. Another man, also in his 60s, is hospitalized in critical condition at Seattle's Virginia Mason Medical Center. Both of those men do have underlying health problems, which makes it harder to fight off. So this weekend, Governor Jay Inslee declared a state of emergency to give state agencies the necessary resources to prepare and respond to an outbreak. Now, among the state's coronavirus cases, a Mill Creek teen who attends Jackson High School. That school is now closed tomorrow. And so is Hazen High School in Renton. And we just learned other schools have announced closures as well. King 5's Britt Moore is live there in Renton to explain why. Britt?
Yeah, Renton school officials are deciding to close Hazen High School tomorrow as a precaution. Again, we're also learning that Kentwood High School and Covington Elementary School in the Kent School District also closing tomorrow. And on top of that, Frank Love Elementary School in Bothell will close as well. This is definitely a growing list of school districts making that decision to close Monday as concerns continue to grow.
Hazen High School in Renton is closed Monday while custodians clean the campus after officials learned a student and their parent were experiencing flu symptoms.
Through the day, they've been cleaning the school, specifically in the high contact areas, hallways, door handles, water fountains, those kinds of things.
The parent, who works in the healthcare industry, got sick last Sunday. The student got sick Wednesday and did not go to school Thursday or Friday. The student and parent were both tested for coronavirus on Saturday and are self-quarantined at home while they wait for test results.
It's important for our families and families all over to know that school districts and communities are paying attention to this. We are prepared.
Jackson High School in Mill Creek is also closed Monday after a student tested positive for coronavirus. That student is isolated and home and is doing well. Meanwhile, Bothell High School was closed Thursday and Friday due to coronavirus concerns and plans to reopen Monday. This closure was sparked by a sick family member of a staffer, both of whom had traveled internationally. The family member tested negative for the virus. And the state's largest school district, Seattle Public Schools, says there are currently no confirmed cases of coronavirus within the school system, but officials are closely monitoring the situation.
Meanwhile, Renton school officials say the student here at Hazen has no siblings in any other school, so that is not a concern right now. But officials are asking that anyone who may have flu-like symptoms, asking that they just stay home. For now, we are live in Renton tonight. Britt Moore, King 5 News.
Okay, Britt, thank you. Also tonight, the U.S. Postal Service confirms a female employee in Federal Way tested positive for coronavirus and is recovering at home. The Federal Way postal facility has been cleaned. King County's Department of Public Health is aware of that case. 7 paramedics in Redmond have been placed on quarantine, but we're told the fire department is fully staffed and responding to calls as normal. The Redmond Police Department said via Twitter, quote, out of an abundance of caution, 7 of our medics have been quarantined due to possible exposure to the COVID-19 virus. Today, New York Governor Andrew Cuomo confirmed that state's first positive case of the coronavirus. The woman in her 30s had recently traveled to Iran. Officials say she's been quarantined in her home in Manhattan. Now, across the globe, there are now more than 88,000 confirmed cases of coronavirus. Johns Hopkins University is providing this map, which shows the number of confirmed cases in more than 60 different countries. About 3,000 people have died, with most of the deaths in mainland China. Now, among the confirmed cases, almost half have already recovered. The World Health Organization urges people over 60 or with an underlying medical condition to avoid crowded areas where they might come into contact with somebody who's sick. China, South Korea, and Italy have the most coronavirus cases right now. Italy's infection rate jumped 50% today. More than 1,600 are infected there. 34 people have died. Masses were not held because churches closed. Close to a dozen towns near Milan are still quarantined. More than 50,000 people are on lockdown. Today, a top Italian official warned of what he called a, quote, possible tsunami effect on hospitals if the outbreak is not contained. So one of the difficult things with something like this is keeping our viewers and the public apprised on any new developments, which have been numerous, especially this weekend, while also trying to not cause any hysteria. Look, there are some things we don't know about the virus, but there's a lot we do know. So let's try to separate some of the facts from fear and give you some figures that might put this virus into context a little bit better. So there have been 2 deaths in Washington state from the coronavirus as of this weekend. This flu season, there have been more than 70 deaths just in Washington state. Nationwide, as many as 41,000 deaths might be linked to the flu. Current estimates say that 80% of people who come down with coronavirus will not need hospitalization. So why is it so concerning? Well, again, it's a new virus for us, and there's no vaccine available for the public just yet. So it's all up to your immune system, which is why it's most dangerous for the elderly and those with underlying health conditions. It also may be easier to catch and deadlier than the flu, but that needs context as well, and we just don't have all of the information just yet. We know there obviously is a ton of information to go through, so we've compiled it all in a special coronavirus section on our website. All you have to do is text the keyword virus to 206-448-4545, and we will send you a direct link so you can go through it for yourself. And coming up in a few minutes, an infectious disease expert answers questions about coronavirus. All right, back to our extended coverage of coronavirus. It's, of course, top of mind with now 2 deaths among 13 confirmed cases in Western Washington. But how worried do you really need to be? Vanderbilt University's Dr. William Schaffner, one of the top infectious disease specialists anywhere in the country, was out on the streets today answering questions.
What's the best way to prevent the virus?
What is the risk for somebody like us to contract this?
How can I avoid it? Avoid people who are coughing and sneezing at the present time. Lots of good hand washing. The people at greatest risk of coronavirus infection are people who are older.
Flu-like symptoms,
Well, it's certainly flu-like symptoms, and the whole spectrum of illness from very severe to much less severe, we're now only appreciating. Older persons, people with underlying illnesses such as heart disease, diabetes, and lung disease, they're more likely to get pneumonia and the more serious coronavirus infections.
Is it airborne?
It can be transmitted through close contact. If I have the virus and I breathe it out, and we're standing this close and you breathe it in, you can get sick.
Do you get the mask that you wear?
That's a very good question. You know, the masks really don't help you very much at all.
What percentage of people now are dying from the coronavirus?
The data from China would indicate it's about 2% of people, but most of us think that's too high. The coronavirus probably can survive on the surface for several hours. The good news is that common household disinfectants will kill the virus.
I'll be flying soon, so I was wondering what precautions or is there any concern?
So actually I think the risk is going to be very low, but every time you travel, wash your hands a lot and avoid those people who are coughing and sneezing. At the present time, I think it's very prudent for the family to think ahead. What if the coronavirus should come and we would be asked to sort of quarantine ourselves at home? Think about what you would do. Who would take care of the children because they may be home from school? Make sure you have enough medicine for people who take medicine at home that might last for 2 or 3 weeks.
Can healthy people fight it off on their own?
If you get sick, we can take care of you. We don't have a direct antiviral drug, but we'll give you good supportive care, and fortunately, most people recover.
And that last part is very important. Most people do recover. One more reminder,